have a look at the investigation and referral forms and referral criteria. So we will just click on it and have a look. Again, these are the commonest ones I use, but there will be a lot more that we will look at. We've already covered care navigation, first port of call. We've already covered local pathways and shortcuts, if you remember. Okay, these are all the kind of new guidelines we have instead of map of medicine. Just hover over it, click on it, and that will take you and give you more details. That's just the nice guidelines. Okay, allergic rhinitis, deafness, tinnitus, vertigo, angina, heart failure, LFTs, constipation, dyspepsia, irritable bowel, CKD, erectile dysfunction, that's quite new, as is the testosterone deficiency one, and the vasectomy guidelines. Primary is new, that's new, that's new, that's new. Heavy menstrual bleeding, that's new. We're waiting for a specific HRT therapy guideline to come. The temporal arthritis one, giant cell arthritis, that's quite new as well. So 2-week referral criteria. So just look, this isn't the actual form that we use to refer, but what I do is if I'm not quite sure whether or not I can refer something for 2-week wait, I just open up the referral guidelines and it just gives me an idea, can I or not refer. Right. Advice and guidance from Barnsley Hospital. What I've done here is I've just listed the ones we can get advice and guidance from at present, and in the near future which ones will be available. AMAC, this is a list of things that might be suitable for AMAC, and if we ring up that number we can just ring up the consultant for advice while they are open without even having to go through Right Care. They won't take referrals, but they will give you advice. Change for Life. It was only recently that I realised that we can still refer patients to Change for Life, and these are the criteria. Exercise Health Referral Scheme, the inclusion. So there's the form that we or the patient has to fill out, and these are the inclusion and exclusion criteria. My Best Life, phlebotomy, when patients can go, safeguarding adults and children who we refer to, Get Fit First, the X-ray patient information sheet. I have already mentioned, haven't I, that I have try and put things into systems, mental health, where are we? ENT, respiratory, cardiovascular, endocrine, gastro, renal, MSK, and palliative care. For example, when it comes to requesting imaging of the head, I've put a list here of what we can refer as GPs and what we can't refer. I've already shown you the mental health access team, the workshops with the dates. So it's not just depression, it has got mindfulness, is it relaxation and breathing and relaxation, and you just have to ring that number. I've already shown you what blood tests are needed before we refer for a special Sheffield clinic. I've shown you the therapy for anxiety and depression. So I just print this out for the patient, just get them to ring up, or we can send this little slip. Don't know how many of you still remember that we can refer to a BPPV clinic that's run by the ENT nurses, and we can refer people to the deafness clinic. Might be worthwhile just giving the audiology department a ring. Okay, they can go straight to audiology without having to go to ENT first, providing there are certain criteria that have to be met. There's a tinnitus clinic as well, and in here you can see when you can and when you can't refer to the tinnitus clinic without having to go through the ENT clinic. And this is quite good, ENT management referral guidelines. This is used by many of the emergency departments, and it tells you how to manage ENT problems, what we can manage in primary care and what we can't. So you may want to look through that. COPD, let's have a look. I've already looked at this, but these are the information leaflets to give for rescue pack medication. We've looked at the GP referral pathway for children with newly diagnosed possible diabetes, how and where to refer. Abnormal LFTs we've already looked at, and it tells you at the bottom what we need to refer to secondary care. Using the FIB4 score. FIB4 score is quite nice to use, where you just make sure you have the age, AST, ALT, platelet count. You put it onto the website. You'll find it under, you'll find it under diagnostic to FIB4. Where are we? You go into FIB4, then you can put those values in. It'll give you a FIB4, and then you can decide whether or not you need to refer the patient. Dyspepsia, LUTS pathway, we've already looked at the autoantibody test interpretation. Depending on what they have, whether or not we need to refer. If it's positive, then we need to refer for further investigations. Dermatology Quality Life Index. Nowadays, especially with dermatology department being so overloaded, if we have filled this in and if the patient scores a high value, then they're more likely to accept. DEXA bone scan. Only reason I've put this down is, again, it just tells me what kind of information I need to have before I can fill in the DEXA self-populating form. A bit of guidance. Looked at the giant cell arteritis. Okay, guidance of when to refer, how to treat. Temporal arteritis, I used to struggle quite a lot, so I've made this with the rheumatology consultant. Tells you what bloods, depending on the blood results, who you refer and how quickly to refer and how to treat in the meantime. Monoarthritis, when do we need to refer urgently to orthopedics? That's the palliative care handover form. So these are, as I said, some of the commonest ones I use, but if you want to look at all the investigation forms, to look at the referral criteria, some of them that aren't self-populating, you'll find the forms in here, so you can either go through it that way. I think there's a link here as well, or I'm going to show you another way. Of course, you can type things in at the top. Or if you look at this box, referral criteria and investigation forms, again, you can click things at the side. Let's do one. Should we do gastro? We've not used gastro yet. So look at this community nutrition and dietetic service referral form. And that would be in Word. If you can't have access on the self-populating, then you can use that, and in the Apple it's there, but in your normal computers it'll be a Word document that will open up at the bottom somewhere. That just shows you in PDF what kind of information you're going to need. And if you want something else, let's see what else we have. Look at this dietitian home visit request, referral criteria for 2-week wait. So just remember, some of these forms are not to use for us to write things down, because there'll be a self-populating form on EMIS or System 1. However, it just gives you a guidance of what can and can't be referred. So that's one way of referring. Where are we? So go back onto the home page. See, another way, it would be gastro, if it was a gastro form, and if press gastro, then the referral criteria form box can be ticked, and that will bring up, again, just the gastro ones.